This has been a very exciting ASH meeting for us. We have 24 abstracts and presentation on our seminal MMRF CoMMpass study, and all kinds of extremely important findings for patients have been discussed during those CoMMpass abstracts, including covering areas of iris disease. And we've done that in a number of very interesting ways, using both crowdsourcing as well as big machine learning. So we basically, working with a firm called GNS, Gene Network Sciences, have been able to come up with a signature of these higher risk patients. In our CoMMpass study, almost 200 patients have sadly lost their battle with the disease within the first 3 years. And we were trying to understand what's different in these patients at the molecular level. We also then compared that signature that we had come up with our own CoMMpass study and compare it to the data in the DFCI IFM study, another very seminal effort, and basically were able to validate what we had found there. We also validated what we had found before, that basically getting a transplant, whatever your genetic subtype, whatever your treatment is much more productive, much more beneficial for outcome for patients. So that's what we found in that piece. And then following up on that CoMMpass study, we always hear that myeloma is a very complex disease, a lot of genetic alterations. What we actually found out is can be boiled down to a small number of pathways, and pathways for which actually there are drugs out there that can be deployed immediately for myeloma patients. So we put in place what we call a molecular profiling protocol that I presented during an oral presentation. And we profiled through this protocol so far almost 350 patients, and presented during that oral presentation the first 230 that we've done successively, and found that about 76% of the patients we profile had at least one of those so-called actionable alterations for which there was a drug in the clinic. And I also presented for the very first time ever during that presentation, to follow up on those observations, a kind of first ever in multiple myeloma master protocol. This is a large umbrella protocol where basically patients are receiving personalized treatment based on their own genetic information. So based on what we find in their genetic of their tumor, we give them the appropriate drug to do that. Also at this meeting, a lot of progress in the area of prevention. MMRF had been investing a large amount of money in better understanding what's going on in early disease. There were some great presentations, for example, from the Mayo Group, from our own awardee, Dr. Irene Gobriel, who showed that there were pathways, again, the MAP kinase pathway, MYC, that seem very predictive of progression to full-blown myeloma. Now, with this information now we understand slightly better who is at the highest risk of progression to full-blown disease. We can already think now maybe we should be treating these patients much earlier, those who are most likely to progress. And there's been data presented during this meeting, both from different approaches, from single agent daratumumab by Janssen to basically treating smoldering patients like full-blown disease with KRD and transplant. Finally, another area where we've put a lot of emphasis and resources in 2017 and going into 2018 is this entire area of immune approaches. So obviously, for those who thought that BCMA was not a target, this meeting confirmed that BCMA is now a validated target, can be approached both with antibodies as well as CAR-Ts, and we've seen even second-generation CAR-Ts, an effort to accelerate that into myeloma patients. So a lot of progress, a lot of hope for our patients that we saw at this meeting here in Atlanta.